Welcome to the Longevity Lab. I'm Dr. Goetz, and the topic for this video is what men should be looking for in a hormone provider, and specifically issues I see in my own practice community preventing men from getting comprehensive, adequate care. So number one is most men at an early age, in their early 40s, are already out there looking for testosterone prescribers, because there's so many advantages to it, both mentally and physically. More motivation, more energy, higher libido, muscle growth, etc. So, there is a testosterone mill on every corner in Arizona, and you can go find someone who will prescribe it to you, whether you are symptomatic and have low serum levels or not. And you can get into a discussion on whether that's a good thing or a bad thing. But here's the problem. Almost all of them are automatically prescribing extra drugs to block men's estrogen and DHT, dihydrotestosterone. So the estrogen blocking drugs are called aromatase inhibitors. The dihydrotestosterone blocking drugs are called 5-alpha reductase blockers. And so both of those don't have any evidence. In fact, especially with aromatase inhibitors that reduce your estrogen levels as a man, there's all kinds of evidence that that's detrimental. And I tell most men a lot of the beneficial effects of testosterone come from estrogen, because when we take testosterone, put it on transdermally or inject it, a portion of it will automatically convert in one enzymatic reaction over to estrogen. And there is a perpetuated gym bro myth that estrogen is bad. And so it is not. In fact, there's all kinds of evidence estrogen's really good for both men and women. And so I know 2 hormone doctors that are on testosterone therapy and also take oral estradiol, because they have high serum lipids and cholesterol, and they're reducing that with the estrogen. So estrogen is incredibly beneficial for serum lipids. And so we're talking about LDL cholesterol, the bad stuff, the things that causes heart attacks. Because what's going to kill most men? Atherosclerotic heart disease, the stuff that causes heart attacks. So if you go somewhere and they prescribe you testosterone and they automatically give you other drugs to block the side effects of the testosterone, they are not following evidence-based medicine. So the other problem with men and these testosterone mills that I see is that they don't get evaluated for all their other hormones. There's 7 or 8 hormones that I'll evaluate on all of my patients. And so I'll talk to a guy who gets a prescription and I'll ask him, well, what other hormones are they optimizing in you? And they're like, oh, they didn't even check. And that's a problem. So I personally am optimized on 5 hormones. And, I check, everything where there's an indication, to check their levels. And so, men need to be evaluated for all the hormones, not just the testosterone. So that's the problem I see. Number one, they're automatically being given estrogen blockers and DHT blockers in a knee-jerk fashion. It's just automatic, and that's not evidence-based. And then number 2, none of their other hormones are being evaluated. So if you're a man, search for a hormone care provider who's going to evaluate all your hormones, follow evidence-based medicine, and not block your estrogen and DHT.